Hi, I'm Dr. Phil Schauer. I'm a member of the Board of Directors of Surgical Excellence, LLC, and I'm also the current president of Surgical Excellence. I'm a surgeon by training, and I practice surgery at the Cleveland Clinic in Cleveland, Ohio. I'm also professor of surgery at the Cleveland Clinic Lerner College of Medicine in Cleveland. I've had a long interest in delivering high-quality health care to patients. To that end, the goal of surgical excellence is to bring together the collective expertise of physician experts and risk management professionals in order to provide and assist hospitals and doctors in providing high-quality health care to their patients. I'd like to talk to you about innovation in bariatric surgery. I see two very important trends occurring in this field. The first trend is the advancement of metabolic or diabetes surgery. That is surgery to specifically treat type 2 diabetes. The other area of advancement is the development of less invasive procedures for treating obesity. Now, let me first address the advancement of diabetes surgery. There are more than 20 million patients with type 2 diabetes in the United States, and many of them are not able to receive adequate control of their diabetes with conventional medical therapies. Despite the fact that many new drugs have been introduced on the market, there are many patients who are not in good control. Recent studies have shown that metabolic and bariatric surgery can not only yield significant weight loss in individuals who suffer from type 2 diabetes, but it can also dramatically improve the control of the disease. Many organizations recently, such as the American Diabetes Association and globally the International Diabetes Federation, have endorsed bariatric surgery as an important tool and therapy for treating severe type 2 diabetes. Now, approximately 80% of patients with type 2 diabetes are obese. So it's quite clear that these operations will have a major role in treating diabetes in the future. Studies are being published that show remission rates as high as 70 to 80% after bariatric surgery. It appears the operations such as Roux-en-Y gastric bypass yield a higher remission rate than operations totally focused on the stomach, such as sleeve gastrectomy or gastric banding. This is very important because we know that long-term control of diabetes is essential to prevent long-term complications of the disease, including retinopathy, nephropathy, neuropathy, and of course, cardiovascular disease. In fact, myocardial infarction and stroke are very common in patients with type 2 diabetes and are the most common cause of premature mortality. Now, the other area I'd like to talk about is development of new procedures. The newest operation on the block currently is the sleeve gastrectomy. This operation has really been around for about 5 to 10 years. In fact, last year it was the most rapid growing procedure for weight loss in the United States. It grew about 25%, whereas the other operations, Roux-en-Y gastric bypass, gastric banding, and the duodenal switch procedure have been fairly stable for the past 5 years. The sleeve gastrectomy is popular because it's a less invasive procedure, particularly compared to the gastric bypass operation. It does have a lower risk of perioperative complications, particularly complications such as leaks, bleeding, bowel obstruction. It also is very effective in terms of causing weight loss. Patients typically lose about 50 to 60% of their excess body weight. The operation is particularly appealing to many patients. For those that do not want to be at risk for complications related to malabsorption, the sleeve gastrectomy does offer that particular advantage. Now, on the heels of that procedure, we're seeing the development of many other similar operations. For example, gastric plication. Now this operation is very similar to sleeve gastrectomy in that it does also reduce the stomach volume by about 75 to 80%. But it does this without requiring resection of the stomach. So instead of stapling and removing the greater curvature of the stomach, as with sleeve gastrectomy, this operation, gastric plication, involves folding the stomach in. In fact, the outer wall of the stomach is simply folded in internally. So there's no stapling or cutting involved. So we think these technologies are very exciting. They offer a very strong potential for improving bariatric procedures by making them safer, less invasive, lower cost, and the end result will be that many, many more patients who are struggling with their obesity will have access to effective therapy.